Good afternoon, everyone. My name's Shelley Ware and I'll be your host today. Welcome to the 4th Life and Health Reimagined online event, Equity During Recovery. I'd like to start by acknowledging the traditional owners on the land on which we meet today and acknowledge all elders past, present and emerging, and pay my respect to all Aboriginal and Torres Strait Islander people watching and joining in today. Unfortunately, we find Victoria in 6 weeks lockdown until further notice, so this couldn't be more relevant today if we tried. So I'd like to welcome and introduce Kelly Horton, who is the Executive Lead of Policy and Development Office at Vic Health, to say a few words today about today's event and topic of health equity.
Thanks, Shelley. Hi, everyone. On behalf of Vic Health, I'd just like to welcome you to this 4th in our series, Life and Health Reimagined. And as Shelley said, focusing today on the very important issue of health equity. Equity has certainly been a theme through our discussions each week up until today, but really we're going to focus deeply on the issue of health equity today. And while we are talking about recovery, particularly where we are now in Victoria, I think we're still talking about equity as we deal with this pandemic, as well as looking forward to how we recover from it. And certainly you'll hear from our great panellists today, and from Sharon Friel, who has authored the paper, which I hope many of you have had the chance to read, and if you haven't, please do so after the session. It is a great read, thinking about what are the really important issues related to equity that have been around for a very long time, but have risen to the surface through this experience of COVID-19, and we've had a spotlight put on them in a way that we haven't before, or certainly in the last little while. And so what can we take from that spotlight? What can we learn from the time we're in now? And how can we think about moving forward in a way that is more equitable, that is healthier, and then is more sustainable for our future? So I really look forward to the conversation today. I want to thank all of our panellists, and thank you, Shelley, and I'll hand back to you.
Oh, beautiful. Well, thank you for coming in and sharing that with us. Coronavirus certainly is acting as a magnifying glass or a spotlight, highlighting the pandemic of social inequities in health across the world. So let's do some housekeeping. If you would like to post any of your questions or vote for your favourites in Slido, we'll get to as many as we can. You can also post any technical issues that you may be having with Slido, and the team will get to you as quickly as possible. And I'd like to welcome back the fabulous Jessamy from Think in Colour, who'll be capturing today's discussion in live illustration, which will be available also after the event. The recordings of today's event will also be made available on the Life and Health Reimagined webpage. And finally, if you would like to multitask, you can join the conversation on social media using the hashtag #HealthReimagined. And now, before I introduce our panel for today, we're delighted to be able to play some pre-recorded opening remarks from Professor Sir Michael Marmot. Professor Marmot is the Director of the Institute of Health Equity and the UCL Department of Epidemiology and Public Health. So let's play that message now.
It's a pleasure to talk to you today. It would be even greater a pleasure were I in Melbourne. I was last in Melbourne, I think November 2018, and had good conversations with people at Vic Health and in the state government and others. So I have a good feeling about what happened in Victoria and in Melbourne. People have been buying Camus' The Plague. In fact, it's rumoured that sales have experienced exponential growth, like the virus itself. And in The Plague, Camus said that the plague is blight and revelation. It brings to the surface the underlying corruption in society. Perhaps corruption is too strong a word, but I've been arguing since COVID-19 happened that it exposes the inequalities in society and amplifies them. If you'll forgive me, I'm going to talk about Britain. Sharon Friel and Fran Baum have done an excellent paper on inequalities in health in Australia and the effect of COVID-19. So I'll talk about the British data, but I think they have relevance for Australia. In February this year, I published the Marmot Review 10 years on. February. Whew. Feels like another era, but it was just before the pandemic smashed down upon us. In 2010, I published the Marmot Review, looking at the causes of health inequalities in England and what we could do about them. And we identified 6 domains: early child development, education, employment and working conditions, having enough money to live on, healthy and sustainable places in which to live and work, and taking a social determinants approach to prevention. The 2020 review looked at what had happened in the 10 years since my original review, and it was not a good picture. Life expectancy in England, which had been improving about 1 year every 4 years for 100 years, in 2010-11 slowed down dramatically. And in fact, the rate of increase in life expectancy more or less ground to a halt. Second, health inequalities continue to increase. There is a social gradient by level of deprivation of area of residence that got steeper since 2010, and the regional inequalities got bigger. And third, life expectancy for women in the most deprived 10% of areas outside London actually went down. Wow, this is really not supposed to happen. We're used to health getting better all the time. And I've been arguing that health tells us something fundamental about how well a society meets people's needs. And health inequalities tells us something fundamental about inequalities in society. So if health has stopped improving and health inequalities are increasing, something's going wrong. And I commented, we lost a decade. Now, what could have caused this problem? Well, we had a new government elected in 2010, and the question is, are they responsible? Difficult question to answer because this is not a controlled experiment. But the government that came in 2010 had as its principal reason for being austerity, to cut the deficit and to cut the debt, to reduce the size of the state. And that they did. In 2010, 42% of GDP went on public expenditure. And by 2019, that 42% had gone down to 35%. And that rolling back of the state had been done in a very regressive way. In the least deprived 20% of areas, local government spending per person went down by 16%. And in the most deprived 20% of areas, it went down by 32%. Clearly regressive. The greater the need, the greater the reduction in spending. And in each of those domains that I mentioned that were in the original Marmot review, things got worse. And it's likely that those changes, the rolling back of the state, the regressive nature of reduction in public spending, and the interruption with policies in those domains, it is likely that they were responsible for the stalling of life expectancy and the increase in inequalities. So that when the pandemic crashed down upon us, we were not well prepared as a society. And very soon, when the data started to come out, the myth that the pandemic was a great leveler was shown to be a myth. Mortality from COVID-19 followed the social gradient. The more deprived the area, the higher the mortality from COVID-19. And the pattern looked very similar to the pattern of all-cause mortality, which suggests that the causes of inequalities more generally, health inequalities more generally, overlap with the causes of inequalities in mortality from COVID-19. The excess down the bottom was a bit bigger for COVID-19, and one distinguishing feature that was different was the high mortality in Black, Asian, and minority ethnic groups. More than half of that excess mortality in BAME, Black, Asian, and minority ethnic groups, could be attributed to deprivation. I was on the BBC, and a senior government person was asked about this pattern. He said it was terrible, that BAME groups had high mortality and they should wash their hands and practice social distancing. And I was asked what I thought about the high mortality in Black British, what we should do. And I said, we should deal with structural racism. Yeah, but what should we do tomorrow? Tomorrow we should deal with structural racism. Start right now. Does that have echoes in Australia? The inequalities in the non-Indigenous population, but the high mortality in the Indigenous population, that is attributable to structural racism. So what happens now? How do we build back better? Well, the first thing I've been saying in Britain, whatever we do not want to go back to the status quo. And second, a lesson from the pandemic is no more austerity. The government said they will spend whatever it takes. Right, no more austerity. That was really damaging. But the other crucial point is to do with the climate crisis and sustainability. If we want to build back better, if we don't simply want to re-establish the status quo, then we have to put the climate change agenda and the health equity agenda together. I'm part of a global sustainable health equity initiative we launched on the 2nd of July with Director General of WHO, Tedros, Michelle Bachelet, the UN Commissioner for Human Rights, speaking at the launch. We had more than 100 global organizations have signed up to this initiative. And we're pushing something similar in the UK, a sustainable health equity initiative for the future. Should we be simply seeking to get economic growth back on track? No, that's not the future. The future should come from what the New Zealand Treasury did, to put well-being at the heart of economic policy, create the conditions for people to have the capability to lead lives that they have reason to value. That's the future we should be seeking to establish.
Thank you, Professor Marmot, for that insight and sharing your insights with us. And I couldn't agree more that wellbeing should be at the heart. So thank you very, very much. Now I'm going to introduce our panel members. And I'll start with Sharon, Professor Sharon Friel. She is the Professor of Health Equity and Director of the Menzies Centre of Health Governance at the School of Regulation and Global Governance at the Australian National Universities. Her interests are in political, economic of health, governance, policy and regulatory processes related to the social determinants of health inequities, including trade and investment, food systems, urbanisation, climate change. So welcome, Sharon. It's great to have you here. And give us away Vedran Drakulic. OAM is the CEO of Gandel Philanthropy, one of the largest family philanthropic organisations in Australia. Since its inception, John and Pauline Gandel have distributed over $100 million to charitable causes in Australia and Israel. Vedran is originally from Sarajevo. Having survived the war and eventually fleeing, Vedran and his wife Anita came to Australia as refugees under the government's Humanitarian Refugee Resettlement Program in November 1995. Vedran is committed to promoting social justice and social cohesion in a country as multicultural as Australia. And in our live studio, I would like to welcome Veronica Pardo. Veronica is the CEO of Multicultural Arts Victoria, the state's leading organisation on diversity in the arts. Veronica is an experienced leader who has led an ambitious agenda of social and artistic transformation in creative industries, working alongside people who have been marginalised through their identity as the other. And Cormach Evans, give us a wave. Cormach is a proud Yorta man and founder of the creator of Strong Brother, Strong Sister, a culturally appropriate safe place for Aboriginal young people to access and thrive. The structure and programs within the space guide, mentor and empower Aboriginal young people to achieve excellence. The outcome comes from these programs also improve Aboriginal young people's health and well-being. So welcome to you all and thank you for being here today with all of us on a very important panel. But let's start with Sharon. Can you give us a quick overview of the paper you and Fran prepared for this week and the impact coronavirus is having on health equity in Victoria?
Thank you. Delighted to join the panel and the opportunity to speak about our paper. I'll start by acknowledging the First Australians on whose land I'm meeting, the Ngunnawal people, and pay my respects to elders past, present and emerging. So we've heard just there from Sir Michael Marmot, really demonstrating the inequalities that have existed within the UK and now the added pressure from climate change, from climate change, but also from COVID-19. And here in Australia, it is no different. There are 3 points that we make, myself and Fran Baum make in the paper that we prepared for this. So the first is, yes, here in Australia, before COVID-19 ever hit us, the health inequalities have been maintained and have been widening. Some very recent analysis that was done showed that from 2011 through to 2016, the inequalities in premature mortality for both men and women had indeed widened across the socioeconomic gradient. There have also been a widening in inequalities in health, in life expectancy and premature mortality by geography. And so certainly living in rural, remote and regional areas, the health experience is much worse than in the major cities. And of course the continuing inequities when it comes to Aboriginal and Torres Strait Islander health experience compared to non-Indigenous Australians. So we've got those inequalities in Australia before we even get to the pandemic, and they've been getting worse. And then the coronavirus hit, and what we've seen is an exacerbation of the inequalities. Of course, it will play out over time, but certainly for communities, for populations in Australia and around the world that have existing health conditions, which we know are greater among lower socioeconomic, among Aboriginal and Torres Strait Islander groups, among rural, remote communities, they're the populations who are experiencing the worst effects of COVID-19. So we see the exacerbation potential for health inequities from COVID-19, but really one of the big points that we make within the paper is don't focus on the population groups, focus on the drivers of those inequities in the first place. And what we're seeing with COVID-19 and the response to COVID-19 is the exacerbation because of some of those underlying social fault lines within Australian society. And if we're going to do anything moving forward, we have to address the social fault lines. And of course, we're going to speak about that particularly within Victoria, but it's all across Australia. Some really nice work that was done by Vic Health, which showed that, so before COVID, well actually back in 2017, 17% of Victorians reported high levels of psychological distress. in the lockdown, not this new lockdown, but in the lockdown that has happened in Victoria in the past with COVID, that level of psychological distress, 44% of Victorians reported distress, psychological distress. That's a phenomenal jump, and we're going to see that continue going forward, and that will be very socially patterned. So we've got the social fault lines that exist within Australian society, and as Michael spoke about in the UK, driven by policy decisions, political and policy decisions that have undermined the conditions in which people live, and have particularly undermined the conditions in which the most socially disadvantaged communities live. So the third and final point that we make in the paper is, okay, well, what has happened as a response to COVID-19? What has happened already within Australia? And why might we learn from that going forward to improve health and social well-being going forward? So the introduction of policies that were just unimaginable before COVID, some really courageous interventions by government. There were 20, just at the federal level, there were 20 different policy responses, from social protection, from employment, from education, from housing, the community sector, and of course in healthcare. 20 different responses almost overnight. So the message that we take away from that is, if politicians want it to happen, it can absolutely happen. We saw an increase in the JobKeeper, the previous New Start Alliance. We saw an increase in that. Keep that in place. We make the point in the paper that having enough material resource to live a life with dignity that allows us to flourish, allows us to have community connection, and that is of course incredibly good for health, requires that sort of social policy that requires a wage that enables that to happen. Keep those sorts of positive policy interventions in place. We saw the introduction of free childcare, a really supportive education-focused policy. Let's think about that going forward. Wouldn't that be an incredible thing to invest right in those very early years? We know that that's incredible in terms of tracking through in life. It helps people find jobs. It helps people stay in education later in life. It helps people find jobs later in life, and it sets people up for much better health later in life. Let's keep that sort of investment. But one of the things that did happen was this differential effect in education and in high school, where some of the most socially disadvantaged children really suffered because of the sorts of approaches that were put in place within schools. And there's been some lovely analysis that was done by the Grattan Institute that said, well, might we invest money that will actually then help those children catch up? And a blitz, they speak about a blitz of tutoring to help those children from the socially disadvantaged households catch up. That will be a very important thing for keeping people well, and also very important for the economy. So things can be done. I suppose that's the point that we make in the third part of the paper. We've seen this a move away from small government to actually quite a courageous government, trying to bring a balance into a range of policy domains. We've seen this ability to hold economic, social and health goals together. It's not just about the economy, but a very important lesson and a very important reminder from Michael is, let's not go back to business as usual. And so my final point, and the point that we make in the paper, is that actually means about governing in a way that is thinking about what is the purpose that we want governing to happen. What should government be working towards? What is the role of business in that? What is the role of civil society in that? And again, we have seen the the voice of community emerge, the voice of civil society emerge, whether that's been through Black Lives Matter movements around the world, but more generally across Australia. Having a voice in the decision-making processes, being at the table, ensuring going forward that those policy responses are fit for purpose, meeting the needs of the community, is essential to, of course, build health equity going forward. So a takeaway message from the paper, which I'm sure we'll discuss now going forward, is policies that ensure enough material resource to live a life with dignity enable us to flourish and be healthy. Having control over our lives in those the way that policy is constructed that enables community people to live a life in a way with dignity. And then the third point is a voice in those decision-making processes, vital. If we are to prevent a return to austerity measures going forward. And the final point I would say is making sure that the sorts of issues that we're going to speak about over the course of this panel are front and centre in the decision-making deliberations that take place in the National Cabinet. The National Cabinet cannot just be about economics and jobs at any cost. The National Cabinet has to be about a social mission. Otherwise, we will see the continuing and the exacerbation of health inequity and social inequity in Australia. So I'm sure we'll get the opportunity to discuss all of that in the panel now.
Well, thank you, Sharon, for sharing that with us. And over the last weeks, we have certainly seen coronavirus numbers grow and lockdowns reinstated, which has impacted some of Victoria's most vulnerable communities harder than others. It's one example of how coronavirus has put the spotlight on health inequities that exist in Victoria. And as Sharon highlights in her paper, are at the risk of being further exacerbated. Now, Vedran, I would like to start with you. How do you think we can make sure equity is factored into Victoria's response and recovery from coronavirus?
Thanks very much. Sharon, it was really good to hear your presentation, and I read your paper with great interest. And it was also really a good introduction to hear from Professor Marmot. As he said, he was talking about the UK, but I couldn't help but thinking that it almost sounded like he was talking about Australia, from the issues of rising health inequality and also, in a way, going back in terms of some measures overall, such as life expectancy. How do we do this? How do we ensure better equity going forward? It's very hard to say. I am, like many others, heartened by some of the measures that have been introduced by the government. But I have to say there is also a bit of caution on my part, at least in terms of going forward. A lot of it was really quick, very responsive, and very productive in terms of the measures that they put in place. But now, when we look at the economic stimulus going forward, the question is how that is going to happen. A lot of people talk about not going to back to business as usual. My greatest worry is that the government and governments seem to be intent on trying to get us exactly back there, business as usual. And particularly in the context of climate action. And I think that's, if I can add anything to the paper that was done, I believe that's one thing that could be really strengthened there. In the preparation for this panel, I sort of looked up online quite a lot of resources, and all our panel listeners can do is just go to Google and Google the expression "build back better." You will find a million examples of what that means and how we should do that. But the key point at the bottom line with all of that is that it has to be with climate action at the center of any recovery post-coronavirus. And I feel that that will be very hard to achieve in Australia. The challenge will be that many politicians and our elected representatives will simply want to go back to where we were before, rather than taking this opportunity and do it differently. There was a very good sentence that I read from OECD report, which said that governments should pair recovery action with climate action. And if we can do that somehow, I feel that that would help addressing inequality at all levels. And interestingly, again, when I was doing that Googling, you would find dozens and dozens of economic-related or business-related fora talking about this and saying it should be done like that, from OECD to the UN, the World Economic Forum, to groups like Building Back Better for Business and so on. But there is nothing really there from governments, not ours, but any government around the world. There are very few that are looking at it through that lens. And I think in terms of even of the comments at the end of the paper, a time for hope, talking about really courageous public policy and things that we can do better. I think, again, the sentence there, if we can add that to that sentence, that all of these things can only happen if we pair them with the climate action.
That seems to be a bit of a theme of today. Excuse me. Remember, you can do your put your questions rather on Slido. We would love to hear from some of your questions. But Veronica, you have a strong passion for equity within the arts, for our most vulnerable. How can we do better in this space?
I think that the critical thing that we're understanding from this moment is the importance of elevating and amplifying the voices of community members and allowing them the dignity of designing their own interventions into inequality. I think one of the issues that we have is we have a really fantastic, very well-intentioned, very well-educated workforce in the public health sphere, but they are not representative of the communities that we really want to impact. And when we look across, so, you know, whether it be the kind of health promotion workforce, whether it be across our media landscape, in the arts, you know, in our political lives, when we see political leaders, we don't see the diversity represented amongst those people. And so what happens is that we've still got a situation where we are designing interventions into problems that are being faced by communities without hearing from communities what it is that they need and the sorts of things that would be effective. They are not partners in that design process. They're not empowered to lead those design processes. And that's what's really critical here. I think, you know, we've a lot of these problems, as we've heard throughout the discussion this afternoon, are really wicked policy issues, intractable and difficult policy issues to move. And yet we've got this untapped resource. And I think that we need to really think about the way that we construct our notions of who is the expert and really place self-determination and communities at the heart of every response. And I reflect on the events of this week and think about how things may have been different had communities been central in designing the response that is aimed at keeping them safe and really engaging them as partners in civil society to really enact the kinds of futures that we need post-COVID.
Absolutely, that cultural safety is just so important, and I agree with you. There should have been some consultation with other members of the community that were going to be impacted. Now, Cormach, you have lived experience and have a passion to see strong leaders within the Aboriginal community. You and I share some favourite things there together. What can we do better together to create equal opportunity?
Yeah, I think everyone summed it up really well already, but that's just a really recurring pattern that we've already heard. You know, ensuring that for us, the work that we do is that our young people's voices are heard. Obviously, we work with Aboriginal young people, And all our work is around listening to their voices, hearing their voices, and designing programs and services that they want and they need. And that's what, in that way, we can actually get the most positive and most excellent outcomes out of that space. But then you also look at, obviously, recently, in terms of the last week of what's happened, and same like Veronica did say, there's, in terms of just consulting with community and, the range of different communities that are around to ensure that community voices are being led, because those community voices are working with on the grassroots level and know exactly what's happening. They know exactly what's going on. They know exactly what their community wants and their community needs to be able to best support their community. But even looking at policies and procedures, and you go back to even the Australia's constitution, and it was written in 1901, and Aboriginal people weren't even recognised as human beings back then until sort of 67 years later. And it's just ensuring that all Australians are included in policies and procedures and constitutions, and equally to ensure that everyone can achieve, the best possible outcomes. Australia's, known as such a wealthy country, but, us as Aboriginal people have the lowest life expectancy in the world, which is just so bizarre to actually think, to know that myself or you, Shelley, could, potentially die at 20 years younger than anyone else on this panel is sort of just insane, when we have such an incredible platforms across the country, but still they're not reaching communities and ranges of different communities as well.
That certainly comes from what you were saying about including community in the process, and I think, and I hope that we are getting better at that. Now, Sharon, how do we reorient prevention resources to focus on the social determinants of health and climate change in such a way that we are more effective in addressing inequity, given that the underlying drivers sit in sectors outside health?
Yeah, that nice, easy question. Well, so I think there's two parts to that, and partly what colleagues on the panel have been pointing towards. So we need structural reform, and we need community level action, and they're not mutually exclusive at all. In fact, of course, they're incredibly connected. And in thinking about what's the sort of structural reform that is required, so that within every policy area there is attention to equity and there is attention to environmental sustainability. And if we had both of those as lenses through every policy area, that would be good for health. It would be great for the environment, it'd be great for equity, and it would be great for health. So making sure that that representation sits in the policy, at the policy table, and what that representation looks like will be quite different, whether it's at federal level, whether it's at state level, but it has to reflect community needs as well. So structural reform, ensuring equity, sustainability and health are represented around those policy tables. And then at community level, and this is where I think the demonstration of how community-owned, community-developed, community-implemented action across a whole suite of areas. And of course, we've got such incredible lessons from Aboriginal community-controlled health services as models. And we've seen this, of course, within COVID as one of the best governance models to ensure protecting the needs of the community which they're set up to serve, in a sense. So using some of the lessons from those sorts of models within health, but spread that across all areas. I think fundamental to that question that's been asked and to everything that we're speaking about are questions of power. And it's a rebalancing the power, the different interests, the different privilege that has access to those structures and institutions that make the decisions. I'll come back to the example of the National Cabinet. Who sits around that cabinet? Who has voice into that cabinet? Which interests, which discourses have penetration into that cabinet? If it's a discourse, if it's the ideas, the power of the idea of jobs, if that's the only thing that gets heard in that cabinet, we have a problem for social equity, for environmental sustainability, and for human health. So how do we rebalance that? And this comes back to, I think, the power of the collective, the power of civil society, to talk about the structural reforms that are needed, to talk about, to articulate the policies that are needed, to articulate the type of community actions that are needed, which I think we're seeing happening already across the country. You know, the anger that people, well, sorry, I should say particularly in Victoria, the anger that communities are expressing as to the way action is taking place. So it's that sort of organised collective action, I think, is going to be so important, but not done in a siloed topic-specific way, saying we need to address the power imbalances, we need to address these underlying system drivers of inequity that sit in the energy system, that sit in the food system, that sit in the planning infrastructure system, that sit in the labour market. They are the things that we need to get addressed if we're going to do anything about equity, climate change and health.
Thank you, Sharon. And that was from Lucy on Slido. And Nick has asked on Slido, how can we build on some of the positive community responses arising from coronavirus, bushfires, and I'll go to you, Vedran, for this, sorry. Most recently in the public housing towers, could this also highlight issues and change minds about inequity to the broader community?
Yeah, an interesting question. I would hope that the answer to that is yes. I was very interested to hear what Veronica was saying, because that is, I believe, one of the key challenges in Australia. We are an incredibly successful multicultural society, but we are far from perfect, and we can certainly learn to do much more and much better in relation to those communities within Australia. As we saw, particularly with the challenge and the issue of the housing estates and towers, I was involved actually at the beginning with the through the Victorian Multicultural Commission. There was a very strong push to try and translate all the materials that existed around coronavirus into a whole range of different languages. But that really, I think, reflects a broader challenge, which is that that was really just the tip of the iceberg of what those needed, because simply just translating a document which is fine for a particular group of people will not answer all the questions that a particular other community might have. And really working with that community as the key driver of understanding what they need and helping them to define that and then share within that community is at the core of addressing inequity. It has to be really proper, a real inclusiveness, not just we'll talk to you when we need to talk to you. I think that inclusiveness in the process from the very beginning all the way to the end is what will help change the narrative and change the outcomes, in fact. So how do we go about doing that? That's another challenge. But I think we hear already from before who are the people that are around the decision-making tables. They're not necessarily the ones that will know that, to understand that. And there are ways in which you can expand the reach of those decision-making bodies to actually have the voices of diverse communities at all levels in the society heard, understood, and then action taken based on that.
Thank you. Now, Cormac, can you tell us a bit about how some of the young people involved in Strong Brother, Strong Sister have found this time, and how you think these discussions and the current public sentiment around the awareness around Aboriginal health can be seized to make positive change?
Totally. So a lot of the stuff that we're hearing from our young ones is around, I guess, obviously with the language that I guess government have chose to use. The word isolation is such a scary word to so many young people because it's like, I'm going to isolate myself from society, from this, from that. And, a lot of our young people are living in overcrowded houses. A lot of our young people haven't got connection to the internet. A lot of our young people, really rely on connection to culture and country and everything else to support their health and well-being. And so, but then also when we look at the education system, it's not built to support our young people realistically. And I think, with recently the movie that just came out, that's been, I think, shown on ABC iView, in My Blood It Runs, is a really great example of that. I'd really strongly urge anyone that's watching to be able to watch that and get a good understanding. But when we talk about education, a lot of our young people find education difficult to engage in because it's not, I guess, supportive nor welcoming for Aboriginal young people when, some of the things you do learn about are, Australia's history, but not the full history, but also, facing racism and discrimination on a daily basis at school. And so then being further disconnected to school is another thing. And so we just continue to see, I guess, further barriers put in place of our young ones over this and throughout this stage. But also, again, I think in terms of the decision makings that are being made, our young people aren't being consulted. And when young people are consulted, then there's things put down upon them. It's not always suited to their needs or their voice or anything like that. And I think our staff have just done some amazing work with the Commission for Young People around that. And so hopefully we can see some really cool voices and amazing work be fed up into government but we need it to be listened to.
I think we're getting a strong theme here. Talk to the people that it involves and have lived experiences. Now I'm going to ask you what Tessa from Slido has had this question going for a while here, and we're going to answer it now. So what are some of the more effective and innovative ways you have seen governments drive shared responsibility and accountability across portfolios to drive outcomes for, someone's added another question, for complex health problems?
I think we can really see that there are enormous efforts to think about what's an innovation agenda for this space that places empowerment with communities. I think we need to look at where the money flows to and how we're resourcing these activities. I think we need to look very carefully at the extent to which the systems and structures that sit within public health initiatives are excluding particular communities from taking control of their own situations and for gaining investments. So when we start to look at the way that systems that perpetuate current systems of power and privilege exclude others, and we think about how we can manipulate some of those systems to try and create greater inclusion and participation, that's where we're going to have the best results. We've seen that across the arts, for example, with the establishment of dedicated funding programs for First Nations artists, for artists of colour, for artists with disability. The reality is that the system is stacked against many of these individuals and groups and communities communities because they're not familiar with the way that the systems operate. So we need to really start to unpack what are those obstacles for resourcing communities. And I think that, you know, we really need to start looking at things. For example, you know, most community groups are funded through some sort of grants process that requires high level of competency in English. It also requires an understanding of the systems that form those funding responses. So how do we do away with those things? How do we recognise that communities have, you know, I mean, I think what's really fascinating about this moment is the paradoxes that it throws up. That yes, while we're talking about vulnerability in communities, what we're seeing again and again is strength. We're seeing community as the kind of key protective factor. So how do we recognise that? How do we resource that? How do we understand that our systems are getting in the way? How, you know, and partly I think that has to do with who's informing the establishment of these sorts of programs. And I'd really love to see, and I think where the best success is to be had is where the design of these programs is in the hands of community. So community designing programs for community. Where we see that happening, we're seeing fantastic results across so many different parts of society.
Oh, there's no question on that, absolutely. Thank you, Veronica. Now, Sharon, Georgie has asked us on Slido, and we've talked about it, the unquestionable need for listening to lived experiences and community needs in policy is growing. However, the divide is inaccessible to federal policy, which makes it appearingly huge. How do researchers and policymakers bridge that huge divide?
Yeah, no, a great question. And I think this is where also the power of community comes in as well, in terms of pushing up, so that the local and the lived experience, the local voices, the needs that everybody on the panel has been speaking about pushes up. So it can push up through the researchers, it can push up through local politicians, local councillors, pushing up through the state level, and then of course also pushing directly up into federal. And that's where the importance of coalitions becomes important. It's where you're being part of some sort of social movement or some sort of organisation that has ways of engaging up, because otherwise there is an incredible divide, isn't there, between that sort of, you know, me as an individual, or, you know, a person as an individual, up to that sort of federal level decision making table, which I think is a very important decision making table. And so being involved, bringing a voice at local level up through processes to push up. Because one thing that does worry me is the pushing down onto community, as if it's the responsibility of individuals and of local community to solve all of the mess that has been happening because of what's happening up in the systems. I find that fundamentally unfair, that it's the community's responsibility to solve that. So it's about the pushing up rather than pushing down. I think as a researcher, we have a fundamental ethical responsibility to use the evidence to make the argument for the connection between the different levels of experience of government through to local lived experience, demonstrating how these systems are all completely interconnected. They're not separate at all. Yeah.
Okay, thank you. Now, Mel, on our last question from Slido, and I'll take it to you, Cormach. What are some of the best practice examples of how to truly include community into policy design that you've seen?
I think, realistically, I think it's the key thing is really starting from scratch, you know, because policies and procedures really haven't included us as, you know, individuals and community members for quite some time. We continue, I think, like everyone has sort of said, we continue to see, I guess, you know, it come from the top and push down upon community, where it actually needs to actually start from the bottom. And so start from that grassroots level and be fed up. I think the key way to look at it is, you know, from a tree, we look at the roots of the tree, and if those roots are really quite strong and powerful and nurtured and everything else, that tree can grow to be big, beautiful, but and give a lot. And so I think, being able to give community voice, give community choice, but also ensure that voices are fully heard, because we see firsthand in the work that a lot of Aboriginal community organisations do, and the outcomes that are achieved by allowing and handing, the work to community to lead, to decide, and have their voice, which is really important. But also it creates value, and it creates trust within community, because it's actually allowing community to make their own decisions, community to lead, because community know best. Each community, whether it's Aboriginal or non-Aboriginal, have completely different needs to the next community, and so we can't just design programs that from the top for one size fits all, because it does need to be adjusted and altered to best serve each different community.
Absolutely. Now, Vedran, I will give you a minute, in our final minute, just to add anything that you would like to add to today's panel discussion.
Thanks for that. I think this last point is really vitally important. There is no one size fits all. The framework might be there that's good and that has some key elements, but actually talking to individual communities and understanding their needs from the very beginning, and then looking at how whatever the framework is can help support them in whatever their needs are, is vitally important. And I say that particularly from direct experiences that we've had working with Indigenous communities around Australia, where one particular approach might really work very well in rural and regional New South Wales, but it would be actually totally inappropriate somewhere in outback Northern Territory, and would have to be, again, completely different somewhere in a sort of metro Melbourne area. So that aspect of working with the community from the beginning to understand what their drivers, what their needs, and what are the ways in which they can meet those needs is critically important.
Absolutely, it sure is. Veronica, do you have a last point that you'd like to add?
Yes, I'd really like to stress the importance that working in communities is, by that we don't mean bringing or importing models that are designed in some kind of, office space by, the experts, and then plonking them into those communities, but that there is a genuine process of engagement and an active interrogation around the way systems perpetuate exclusion, disadvantage, marginalisation. So when we're talking about this work with communities, it doesn't look like any of the work that we've seen before, with the exception perhaps in some Indigenous communities where there's, certainly I think those communities are leading the way in terms of this self-determined work. We're talking about throwing away the models and starting again with resources on the table and with the capability of communities to be experts in their own lived experience, and to be the architects of future programs, interventions and strategies aimed at facilitating their well-being. So if it looks like something that we've, tweaking around the edges of things that, models that have been around for a long time, I think it's going to be the wrong approach. This is a time for innovation and for placing communities in the driver's seat.
Brilliant, and that is a perfect note to end on. And I think we should get this on mainstream media. This was so good. So well done, and thank you to absolutely everyone on the panel. Sharon, Vedran, Veronica and Cormach, you have been brilliant. Thank you for your insight. Thank you for coming into the studio. Thank you for taking time out of your day and joining us on the Zoom. And thank you to everybody for watching. And thank you also to Jessamy. You have been brilliant once again and captured everything that we have talked about that will be available for everybody to enjoy afterwards. So next week's Reimagined event is Thursday the 16th of July at 2 p.m. and the topic will be the future of prevention. So thank you everyone for your questions today on Slido. We're sorry we didn't get to all of them. Maybe we can catch everyone on their social media and you can ask them directly. So take care of yourself during the lockdown and look after yourself and your family, and we'll see you next week.